Hello, good evening, everyone. I am Zainab Awad. I'm the manager of the CLI Health program at the Global Health Institute of EUB. I would like to welcome you all to our first webinar of the program's webinar series. The CLI Health program, CHP, is the new pioneering program of GHI that has been recently launched in October 2024. The program aims to explore the nexus of climate change, health, and social justice with a special focus on vulnerable communities in the MENA region. As such, our program focuses on understanding the impact of climate change on health at multiple levels and evaluates the strategies for climate resilience of communities, healthcare organizations, and health systems. To learn more about our program, please feel free to check the website. I am dropping the link shortly in the chat box. Going back to our webinar, let me please warmly welcome Dr. Shadi Abdullah. Dr. Abdullah is the director of the National Center for Natural Hazards and Early Warnings, the chair of the Arab Science and Technology Advisory Group for UNDRR, and the president of the governing board of the International Center for Advanced Mediterranean Agronomic Studies. Welcome on board, Dr. Shadi. We're so glad to have you, and we're looking forward to a very interesting webinar ahead. Before I give you the floor, I would like to ask our attendees, please, to feel free to drop your questions in the Q&A box, as we will have the last 10 to 15 minutes allocated to address your questions. Dr. Abdullah, the floor is yours.
Thank you so much, Zainab, and it's a pleasure to be part of this series of webinars, especially with the EUB, with the Climate Health Program, and with your institute. So today I will be, let me share the screen first. Today I will be talking about, yeah, okay. You can see the screen now.
Yes, if you can do it in full screen mode, that would be great.
Yeah, well.
Okay.
Okay.
Perfect. Yes. Thank you.
So today I will be talking about mapping climatic impacts on health, especially on the GIS innovation for disaster risk reduction and resilience. Sorry. Okay. So first of all, let me talk a little bit about the CNRS, our center. So there are, we are considered at the CNRS as the scientific arm of the government. We have a new strategic orientation since 2023, dealing with the research for the society, research for development, and research based on public and policy decision-making, and tackling all the current issues and challenging in the country and in the world. So first of all, our center started with a platform which was part of the CNRS. It was in 2015, and it was tackling with the early warning for natural hazard, but it was a platform within the CNRS. We shifted to be a part of a national platform, which is as a part of the government in 2023, and we became in early 2024 as a National Center for Natural Hazard and Early Warning System. Of course, all our product or our forecasting and the early warning that we do is directly connected to the DRM unit, the operational room at the Prime Minister office and at the Presidency of Councils of Ministers. Our main activities and mandate are hazard and risk assessment, forecast for hydrological hazards, record daily natural hazard and casualties, promote preparedness and preventions on facing hazard, assist with emergency operation, post-disaster surveys and data analysis, and also to produce timely, high-quality information for decision making. And this is very important, and we are going to talk a little bit about this. So the structure of our center, in very short, it's a research center, it's an expert center. We have the researchers. We also have the scientific experts from different universities, from different research centers in the country. And of course, our main stakeholders are the ministries. We have partner labs, international one, like the NASA, like the ESA, like CESBio, and other agencies and labs, scientific labs around the world. And of course, we seek funds as any other research centers from the EU, from the World Bank, UNDP, and others. So throughout the years, we have been having production units where we have these chain of processing information. We have a large and a huge environmental database that we have been collecting all these GIS and remote sensing data since 1997, 1998, where we start collecting these information, and it has been building up all over the years with different processing chains, and we have different integrated models for the floods, for the droughts, for the desertification, snow mass movement, and other. Of course, the last unit in this center is the active stakeholder unit, where they can access the data, the information. We have put with the DRM unit some contingency plan, quick assessments, like rapid assessment for certain hazards and for certain indices. And we are working on the post-analysis and, of course, what is called the crowdsourcing. And we are going to talk a little bit about this and its relation to the public health. Of course, we use satellite imageries. We have a mobile operation. We have institute stations all over Lebanon. And we are working with National and International Institute. The five centers that are related to the CNRS, as you can see here, all of them, they give information to the platform, where the platform is communicated directly to the DRM unit, where the decision is taken during the disaster and the big hazards. So what are the main role of the GIS for the resilience health system? It could articulate mainly on five main axes, which are the public health infrastructure, using the GIS for this. And I believe like the Ministry of Public Health, they are doing quite well in building these information, GIS information and infrastructure. We have the disease surveillance and monitoring, and you will see what we have done during the COVID-19. Also, the other axis that could GIS help is improving access to care, where we talk here about analyzing the transportation network to optimize ambulance route and others. We have used this during the 2016 war on Lebanon. Health information system integration, of course, centralizing all these health information and data in a geospatially enabled environment, and this is very important for the decision making. And of course, last and not least, we can use the GIS to see the impact on the climatic health. And this is the most part that I will be talking about, what we are doing at the center and how we are linking this, and how we, together with the specialized institute like the EUB, the health centers, okay, could integrate together in order to give better information and better decisions, and to work together with to the last mile. So this is one of the figures that summarize what is called the climate change impact, as you can see here, where we have the greenhouse effect, we have the climate change. And then what does this mean? It means that we have impact with the ocean acidification, we have raised average and extreme temperature, okay? We have altered rainfall pattern, where we have like heavy showers and heavy rainfall than usual. We have the sea level rise. We have the extreme weather conditions, where we have drought. We have forest fires and others, as you can see here in the diagram. So the flood, heat waves, droughts, and fires, and how all of these related to reducing the agricultural productivity, reducing the fisheries, biodiversity loss, the ozone increase, participating in increasing the pollution. Of course, all of these, you know that at the basis, it will affect and impact the people in terms of their diet, in terms of the nutrition, and impact on mental health and other harmful diseases that could result. This Of course, it is also bordered or enveloped with the most important thing that, especially in Lebanon, we have it is the social impacts and the social factor, like the loss of the houses, the poverty, the mass migration, the violent conflict that we are facing in the last couple of years. All of these, they are adding up with the climatic change impact to see how this will impact the people and the life of the people. If you go to the statistics in 2023, it was a significant year for disaster impact, where we had like 399 large and huge reported disasters over the world. We have death over 86,000 people, and we have this is due to the climate, of course. We are not talking about the conflicts and the war conflicts. We have 93 million people that were affected and losses of around 202 billion USD. And if we look at these type of disasters and we go back to the what we call to see what type of disasters, like in the last 10 years, we had an average of 3,751 natural disaster, out of which 84% they were weather-related disasters. From these estimated number of people that were affected, that there were like 2 billions, 95 were due to the weather-related hazards. And in the terms of cost of damage and losses, 73% they were also the weather-related hazard. When we talk about weather-related hazard, we talk about the climate change impact, and we talk about how to forecast this, okay? Because if we have a climate, then we are able to forecast, and then we are able to do what is called the early warning system, and we are able to perform an early action. So it's always, when we talk about early warning, it is combined with the early actions. So the main 4 pillars for the early warning are the knowledge in disaster risk. This is the first pillar. The second pillar is how we are able to observe and analyze the forecasting. The third pillar is to have a real warning system, communication system, like our dissemination system in place. And the fourth pillar, which is the most important, this is the last mile of the complete cycle, is to be prepared, and we have a response capabilities and the response plan. Of course, an overarching governance framework performs as an articulating factor to ensure that the institutes and the legal framework are working together in order to have a better operations and clear roles and responsibility. The main problem, like for us, especially in Lebanon, that a lot are working on many issues, but when a disaster, when a crisis come to place, nobody holds responsibility. So we need a clear standard operational procedures, which are called SOPs, and we need really a clear mandate for the institutes in order later on to be holding responsibility whenever we have a certain crisis or a certain issues taking place in the country. In general, in Lebanon, for the climatic change, the historical trends show that the mean temperature have increased 0.3 per decade since 1970. And if we are, it is very high compared to the global trend. And since 1960, we have reduced in 11 millimeter in a monthly mean rainfall per decade. Also, since 1960, we have a 7% increase in the number of the hot nights, mostly during the summer, and the sea level rise. Also, we have a 2 millimeter per year, with the water temperature increasing 1.3 degrees since 1980, that has increased. Future projections, we can look at the temperature that are set to increase by 1.7 for the mid-century and 3.2 for the end of the century, and this is on the different RCPs. The rainfall is expected to decrease by 4%, and of course with a drier period, but also with a change in the pattern in the rainfall, which could lead also to more what do you call it? Little bit, we can say that it is tending towards the droughts. And also we have an increase in drought duration, and we may face like an increase in the by 30% of the flooding and the damages for the infrastructure. So this is one of the things that we are conducting at the center, where we are mapping these information. So the first pillar of the early warning and the early actions on different categories is to have an information on the risk and understanding these risks. And these play an important role, and we work together in order to place it and to do these different models to take or to be able to get like the hazard and the risk map and the risk assessment. So these are examples of the storm hazard potentiality and flood hazard potentiality impacting like urban areas where we have the informal zones, the rural areas, and the central cities. So vulnerabilities and desertification, storm hazard map, flood hazard map. So this is one of the mandates that we are working at and that we are producing to the government in order to help in understanding the risk and to pinpoint the areas where we might have a risk depending on the vulnerabilities and the exposure, of course. So mapping all of these, they are using models, GIS models, GIS techniques, remote sensing techniques. So it's from the modeling to the simple mapping, as you can see here. We worked with this during the earthquake that took place in 2023, the last year in January, February. The crisis that happened, and both the Ministry of Health and the Ministry of Education, they asked us like to place all the critical assets like the hospitals, the civil defense, the schools, and the first responders agencies on the different hazard and risk map in order to see the exposure to the vulnerabilities and how they are going to proceed if something takes place. So this is from the simple mapping. We use the interactive dashboard at the National Operation Room in order to work on and to map the isolation centers and the isolation areas that have been allocated by the government and their status, of course. And this helped a lot during the COVID-19. We used the interactive dashboards also for doing the statistical analysis, the same one that you have been seeing in the Johns Hopkins. So it was the very first time where Johns Hopkins University started like to releasing these dashboards, and later on each and every country started to release their own dashboards with their own statistics and their own information. And we were like in the Arab region, we were the pioneers in Lebanon to use this type of technology, which was, at that time, it was the first time like to be used, and the technology that was like really new and a top-notch one. Also, we worked on mapping for the decision makers, the occupations of the hospitals. So the hospitals used to give us every 1 hour the status of their occupation, okay, and the status of how many dead people, how many they are chronic, and other information for the decision maker in order to take the proper actions and the proper decisions at the operational room, as you can see here. Also, the isolation center, we used actually both, because in Lebanon, you know that we do not have what is called the census, the population census. So we don't really know where are the people located. So we made an agreement with the Facebook and with Twitter in order at that time, in order to get access, okay, to the people, how they are interacting in the social media, and to get the heat map. So we were able to allocate the people and where they are allocated because of this technology. And we were able to, depending on the level of on the risk level of the COVID-19 and the people affected, to isolate certain areas, villages, or towns, depending on certain equations and depending on certain index. So we were releasing every week, if you recall, like the names of the municipalities of the villages that should be isolated. Also, we worked on the impact of the climate on the refugees, on the Syrian refugees, as you can see here, and the cost of damage. This was very important for the people working on the humanitarian issues, in order to allocate these vulnerable people and these people that are living in a very harsh environment, of course, and they are exposed. They are highly exposed to certain hazards, especially the climatic ones, as you can see here. So we are working with the World Bank. We have been producing a series of information. The last report was produced earlier in 2023, sorry, at the end of the 2023, which was a series of information and calculations and studies on the climatic change impact on different sectors in the country, using the RCP 8.4 and 4.5. We started with some examples on the impact of flood hazards on the poverty and the distribution for the flood, for the storm, and for the landslides, as you can see here in these figures. And we have done the projections of these till the end of, or to the mid of the centuries, on different hazards, as it's clear in these figures. This is the storm hazard and the distribution on the elderly, not only on the population. And we have something on the agricultural sector, on the women, on the genders, on the disabilities, and there are a lot of numbers, a lot of figures, and a lot of calculations. One of the things that also we are conducting here related to the climatic change, and of course, we are only relating this, and you will see, like, we are working as a scientific institute in producing all these forecasting and impacts on impacts of these disasters, okay, on people. And we still need, like, to go with the last mile to connect all of these on with the health system, with the impact on the health and on the people. This is a daily fire danger forecast. So we are able, through the satellite imageries, to do a forecasting for the next 72 hours on a daily basis, the potentiality of having a fire in different cadastres in different regions. So we are releasing this bulletin on a daily basis. It's as you can see here, this is the English version, so we can know in each city and each village what is the potentiality of having a forest fire, and of course its impact on the people and on the health, as you can see here. We released also for the communication, as I said, like, you need all these systems. We are talking about the 5 pillars that I started, or the 5 axes that I started with, the utilization of the GIS and the remote sensing in the public health. So this is one of the main axes, which is communicating and reaching out to the people. this is the Lab Fire app. You can download it from the App Store or the Google Store. It's called the Lab Alerts. We have the earthquake and the lab fires, where you have notification of and pop-up notification that can reach out to the people and reach out to you if you are like in Beirut, you are going to Akkar, and there is a potentiality of having fire in Harar or in any place in the up in the north. So whenever you are there, the app will know that you are in a place where you have a higher potentiality. So it will give you a pop-up message telling you that, okay, be careful if you are going out, if you are having a picnic, barbecue, whatever. So the potentiality or the risk index is very high. So be careful when you are in the forest or in places that could ignite a fire. Of course, within the app, you can see all the statistics in your village, in your district, or in the place that you are living, and you can see all the statistics of the fires that has been taking place with the wooded lands, with the agricultural lands, with the grasslands from 2016 on a daily basis till to date. We have instruction, of course. This has been done with the DRM unit, how we are going to react if we have a fire, whom to call, how we are going to work to be prepared in case of if you are in a place where you have forest fire. We are helping also people in order to understand the propagation of the fires, especially with the fire defenders, the first responders, the civil defense, the people who are fighting the fires. So whenever we have an XY coordinate of the fire, we can immediately, through these applications, through these propagations, using the remote sensing GIS tools. Of course, here we can see the crown of the fire, how it will be propagating with the time, as you can see here. So we can know, like, within 1 hour, the fire will be propagating in this direction. We only need the wind direction and the wind speed, and everything is calculating, because in the background we have the land cover land use, we have the elevations, we have the slopes, we have the aspects, we have all these GIS layers that will be running in order to give us this type of mapping in a near real-time mapping. This is the propagator, and also we have identified and updated this. If anybody is interacting, as anybody is intervening in these areas, we can allocate this intervention, and we can see how with time this fire will be propagating. And this was very useful during the fires with the first responders in order to inform them what are the proper action to do, and to lower the risk on the people living in areas where there are a lot of forest fires. We are working also on the forecasting for the floods. You know, we have been facing a lot of floods, flash floods in Lebanon. So we have these forecasting models, hydrological models, like we can simulate, and then we have a precast, nowcast, and forecast, and we are able now to predict the areas that could be harmful for, or could be flooded in a certain time. This is in Ras Baalbek. This is a simulation of 100, like if a 100-year of flood will hit the area. These are the areas that will be flooded, okay? And this will inform the people how they are going to react, and the planners, how they are going, the urban planners or the people who has the decisions, how they are going to tackle, let's say, a frequency or a repeated time of the flood, okay, of 100-year or 50 years flood that will take place in there. town. As you can see here, also we have mapped what is called the time to safety. So people with disabilities, people with like average people, elderly and small, small people, how they are going to react and what is the time needed, as you can see here in this figure, how much the time is needed for these people with disabilities or the people that are, that has a higher vulnerability for flooding to reach out to the flood safety zone, how much time they need. So this is one of the exercises that we have been taking or we have been working on in this domain. Also, for each and every river or most of the rivers in Lebanon, we have published what is called an assessment dashboard, where it is an interactive dashboard. We don't have time to show everything, but where you have the exposures, as you can see here, for the structures, road, and agriculture, and the vulnerabilities accordingly, and who are the people that could be affected if a flood of 10, 20, of a frequency of 10, 20, 50, and 100 years. Usually in the floods, maybe for those who do not know really how the floods are calculated, sometimes we say that there is a rainfall, and this amount of rainfall could cause a flood of 10 or 20 years. And every 20 years, a certain amount of water will fall and will cause a flooding of a 20 years extent, okay, of the flood. It means that we should be prepared, and the extent of the flood, this is the 100, like, as you can see here in the figure, this is the 100, the other color is for the 50, and the other one is for the 10 years flood. So the 10 years flood is more frequent than the 50 and then the 100. But if the 100 would take place, then we should see all the assets, all the exposures, the roads, the agriculture that could be damaged, and we should be prepared, and the people that will be under the risk. Also, we are using drones and other tools and GIS tools to map the landslides and the impact of the landslide. This is one of the examples in Kfar Nabrach. We use the drones, and as you can see, and with the GIS model, we were able to allocate the areas that could be damaged, like propose that these are areas to be that could be that we can have a failure. This is the first failure, and this is, as you can see here, this is the second failure that we have expected. And accordingly, we were able with these tools, with these, I always talk about the drones, the GIS tools, they are like toys for us. So we were able to model this, and we were able to inform the people, to inform the DRM unit, the municipality, where are the houses to be demolished in order to prevent like future failures, and to help people and of course to help the people in the region to be more safe. This is what is called the DM, the digital elevation model, and as you can see, the values, okay, the negative values where the land have been subsiding down, okay, with around a 6 or more than half a meter in the region. Of course, when we talk about risk, we talk about the hazard, exposure, vulnerability, and lack of the coping capacity. So we were working together with the Lebanese, the German Red Cross, on what is called a project. It's called the FBF, the forecast-based financing. So if we know that a certain incident will be taking place, okay, at in a certain locality, okay, and in a proper time, we can move certain funds that are available in order to more or less to reduce the impact of this incident or this hazard. Like if I know there is a forest fire or a heavy rainfall that will take place, and then the flooding will happen. So in a certain area, if I know it like prior to this event or incident that is expected to happen within within 3 days, I can move certain funds to the people in order to maybe to really reallocate the people or to help them to move or to put certain barriers to help the people not to be or to reduce the impact of the flooding. So we were working with these. Of course, recently we have released what is called the informed risk. And this deals with all the hazard, the natural and the human hazards. And we calculated the vulnerability. And here the vulnerability is the most vulnerable group and the socioeconomic vulnerability. And also we calculated the coping capacity, the institutional one, and the infrastructure. Okay, so whenever we are calculating the risk, we are doing all these calculations on the cadastral level, yani on the village level, okay, in order to get this information and to build upon which we are going to intervene. We started with the heat wave. Unfortunately, or fortunately, we didn't have we had the war, but we didn't have like heat waves in the summer. So we were prepared according to certain criteria and norms where, like if we say that we are facing, that Lebanon will be facing, or a certain area will be facing a heat wave, it means that we have three consecutive days where the temperature average exceeds 10 degrees, the average one. So, and the humidity will reach the 90%. And of course, we have a difference in temperature between night and day will be minimal. So at this stage, we say that Lebanon, or we are expecting to have a heat wave. Accordingly, we mapped all these, okay, on certain, like we did the calculation and the modeling for the urban heat islands, especially in the areas where we have dense population, the suburbs around in Beirut, let's say, in certain parts of the Dahi, the southern Beirut, and the northern part, like in Burj Hammoud and others, and also in Tripoli, as you can see here. So we were able to do the zoning for these areas and to see how we are going to help the people if we had a heat wave, okay, with fans, with moving maybe with the Red Cross, like checking on the people in these areas during the heat waves and giving like some recommendations and some alerts and moving certain funds for these people who are unable like to reach out to some of the maybe fans, or they do not have electricity in order to help them in facing this type of hazard. So we calculated this with the exposure and vulnerability, and of course the hazard is a near real time, and we allocated the areas that have been earlier established or earlier have been identified by the government. And as you can see here, we were able to allocate these areas, as I said before. Also, now we are working like after the crisis, the war that we have faced, we start working on the winter storm and the risk mapping. And as you can see here, we map all over Lebanon the hazard and the exposure, the lacking of the coping capacity, vulnerabilities. And we got what is called the winter storm risk map, where we have in these localities, especially that are exceeding a certain elevation, and we have lack of coping capacity, we were able to allocate these areas. And now we are working with the Red Cross on identifying and scoring these areas, okay, through the structure type, the capacity of utilization, the ownership. And then we added on these what is called for the war, we added two categories, which are the bombing where are the areas that has been heavily bombarded and raided in the different regions in the country. And also we use what is called the IDPs, the internal displaced population, where we have what is called we categorize this as in the age group, in the health conditions, and if they got a donation. So we are coupling all these together in order to highlight like certain areas. If a harsh winter storm will take place, to see these vulnerable people, highly vulnerable people, because of the war, where they are displaced, okay, and what are the means that they are using in order to or to try to intervene in this very harsh environment and harsh conditions. Of course, what are the future trends? So there are like, if you want to say that there are a potential to transform health system by enabling smarter and more responsive tool for decision making, integrating into GIS, into health information system that can empower the countries and Lebanon, of course. But here, if we talk about what are the main future direction, we can talk about 9 to 10 maybe pillars that we could be working on. One of which is advanced data integration and analysis, where we have a multi-source data fusion, where we have a combining satellite imageries, IoTs, sensors, health records, and climatic model to analyze spatial correlations between climate change and health impacts. We talk about the big data analytics, where we use the machine learnings and artificial intelligence. We talk about the real-time monitoring and the early warning system, where we have dynamic dashboards, as you have seen, with interactive platforms that provide real-time updates on climatic variables and potential health risk. And this is very important. We also talk about predictive systems, like an AI-driven tools for forecasting events like heat waves, air quality. And this is what we are like more or less currently we are doing in the country. We have the climatic health vulnerability also mapping, where we talk about the dynamic risk map, like GIS tools for identifying and visualizing areas of high risk. Equity-focused mapping, highlighting on the vulnerable populations, such as low-income communities and area with the limited healthcare and infrastructure. So these are more or less important. Another aspect that we could talk about, which is the remote sensing and the drones, while tracking environmental changes like deforestation, urban heat islands, water availability that can influence the health. Also using the drone surveys and high resolution mapping for inaccessible area affected by extreme weather and or disease outbreaks. الحمد لله نحن ما عندنا اياهم، يعني بعد ما عندنا most of the areas that are reachable in Lebanon, we don't have like big disease outbreaks, but this is one of the tools that could be helping as future trends in utilizing the GIS and the remote sensing tools. Of course, we also talk about the integration with the health information system, like the interoperability, linking GIS with electronic health records and national health database for comprehensive spatial analysis. This is a huge work that should be done. The Ministry of Agriculture, like it's working now on identifying like the farmers and linking it all of it with the GIS database, or a big information system, but it's still in pilot areas. So we are also looking forward to have this system integrated in the health sector. Of course, the telemedicine expansion, like mapping and enhancing access to healthcare in regions affected by climatic stressors. There are two projects that are ongoing now I think in Akkar, dealing with this matter. The participatory approach and community engagement is very important. The crowdsourced data. I gave you an example with the uh, social media, how we were able to get information about the population density, but also it could be used in order to empower communities to collect local data on health and environmental condition, and this is very important. Decision support tools, also user-friendly GIS application and policy making. And last and not least, we talk about the climatic resilience infrastructure planning, like simulating certain models with GIS for planning healthcare infrastructure, and also with the green infrastructure, spatial planning for natural solution like urban forest and wetland mitigation health risk. We talk about policy integration and decision making, like scenario planning, cost benefit analysis. Also, it's very important. Last and not least, we talk about capacity building using this GIS and training open source GIS platforms, promoting accessibility and usage among developing nations and countries for localized climatic health studies, and also certain training programs to build expertise in GIS application for climatic health. So these are the main component that we could have as a future trend in the GIS. Finally, this is our website where you can browse and you can get different information. You can access the different maps, platforms, dashboards, interactive mapping, if you are interested. And thank you for listening and for your time.
Thank you so much, Dr. Shadi. Thank you for an eye-opening and thought-provoking presentation. I think we will give the remaining time for a Q&A. We have a couple of questions in the Q&A box. I will read it for you, and if you please feel free to address. First is from Mustafa Hathal from Hungary. He says, I'm working on spatial analysis of water quality in arid and semi-arid region, and I want to work in water recycling solutions in these regions. I'm asking about the technical side of mapping system buildings, like as scenarios. What do you think about the prediction model you built VRA analysis supported by GIS system? So the questions are, what do you think about the prediction model, and did you build VRA and analysis supported by a GIS system?
Yeah, sure. We are working a lot of this. I didn't have the time to allocate like various aspects on working on the AI models. Like we have built a lot on the GIS AI models for identifying solar panels. Now we are working on linking these solar panels, especially in the Bekaa Valley, on allocating what is called the solar panels that are used for the irrigation. So we are linking this with the production, with the yields and the impact on the food security. So we are connecting these. We were able like to identify in Lebanon each and every solar panel on a village basis. Now with the war, we are integrating this to allocate all the demolished buildings because of the war, using the satellite imageries, using the AI, the machine learning, and the deep learning, in order to allocate them, to allocate the heights of the building, and also more or less to work on what is called calculating the volumes of the rubbles that are in place, in order to see how we are going to use this in the CDWs, and how we are like to prioritize the areas for the CDWs.
Okay, so the same person is asking, what are the software or techniques that you use for the forecasting and predictions?
We are, there are a lot of techniques, like it depends on the forest fire. We have some called the Risico models. We use GIS. We use some integrated models. Of course, some of them like scripting on the Python, but others they are using ArcGIS models. Others they are using like continuum models for the flooding, for the hydrometeorological. So there are various of models that we are using. There is no specific model for this.
Okay, great. So Dana is asking, what are the indicators you look at to identify the potential risk of fire, for example? Is it only related to temperature and climate, or it also considers other factors, as for example, the vegetation cover, pollution, distance from accessible routes, etc.?
Yeah, thank you for this question. So actually, we have uh, we build a model. It will take some dynamic aspects and some aspects that are like stable. One of which is the land cover, land use, um, the slopes, the aspects of the slope, the orientation of the slopes, the distance to villages, the distance to roads. It also take some of the what is called the level of poverty in the region. Okay, these are some stable model that is changing every 4 to 5 years. But we have dynamic models or dynamic factors, which are on a daily basis or sometimes every 3 hours we get an estimates or we get an information from the satellite imageries related to the temperature, the humidity, uh, the soil humidity, the leaf area index, of course the dead fuel, and other factors that are dynamic, like the health vegetation index, and all these parameters that are combined together, and they are put in a framework in order to produce what's called the fire danger potentiality map on for the 72 hours. And during the fires, we are able like to get the what is called the rate of spread of the fires, depending also on conditions and parameters that are accessible from satellite imageries on every 3 hours.
Now I think I have a question for you, if you may.
Yeah.
So, Doctor, you have mentioned your collaboration with the hospitals during the COVID-19 pandemic to generate the dashboard that you had displaying numbers about patients with different characteristics. To what extent you think, if you want to stop sharing your screen.
Sorry, I'm trying to get the yeah, okay.
Okay. Okay, so in your opinion, to what extent are the healthcare organizations in our country, or maybe you can consider the question at the MENA region, ready or capable at this point to leverage the use of GIS for preparedness and for climate resilience during times of crisis?
I think it was the very first time, like we started with the dashboard, but the dashboard, like in order to get this dashboard, there were like a survey. So each and every hospital had this type of survey that are linked directly to the dashboard.
Yeah.
So from that time, most of the hospitals, most of the people, especially the Ministry of
Health.
Public Health, they realized the importance of the geospatial analyst and how to be connected, okay, together, and to have this geospatial, know-how, and the type that or the information that we are like extracting from these input data, it shed the light of the importance of the GIS. Now with the crisis that we had with the war, so they were using immediately these information in order to enable, especially in the Ministry of Public Health, to enable or to help the decision maker to take better decisions and to work with it. So in the MENA region, in Lebanon, and in other places, I think now the use of the GIS tool, it was like a type of what do you call it? It was not let's say it was not an obligatory, but now I think we cannot work or we cannot do proper decision
Yeah.
without having these tools inside our hands. It's like not using the smartphones. So
Yeah. Yeah.
it's more or less the same. And now with the new tools of the GIS, now it's being more and more reliable and more
Mhm.
and more. Yeah, you do not need like very professional people to work with the GIS. Now it's very basics. It's like if you take like a couple of courses in the GIS,
Mhm.
I think it is you can use it as a Word or as an
Yeah.
Excel sheet.
Yeah, yeah, interesting. Very nice. So we will take the last question before we close. Hania is asking, or Hania says, it was noticed that in crisis in Lebanon, we do not have a formal way of communication. How can an early warning system be built to be trustworthy and to reach people? Google has something. Shouldn't we take this into consideration? Over to you.
There are many platforms like even in the like during the war, I will give you just a good example. Also, I'm referring back because we are talking about the public health and in 2006 war and during the Beirut explosion. Uh, at that time, they were using like different each one of the people on the ground, they were like talking about the injuries, about the death, about the what you call it, about the destruction that took place. But here now in the 2024 now, nobody is allowed to get any information or to read any information about injuries, death, else than the public Ministry of Public Health. And these are using also a platform, a unified platform, in order to inform the people. Why I'm saying this is that we have a lot of platform, we have a lot of what we call tools in our hand, but who officially can tell us that this is correct, this is wrong? So there is an urge and a need for a unified platform
Mhm.
that can give the citizen in Lebanon an information about a certain type of hazard, and it is a scientifically based information. And this is why we started with, or we initiated what's called the Center for the Natural Hazard and Early Warning System, because we have a clear mandate and we have all the information to be produced to the ministry, to the Prime Minister office in order to release if there is an alert or not. So you might have a lot of platforms, it's a science, it's tools that are within the hands, but you need, at least in Lebanon, or at least for the government, to have an official website and an official platform that people can log in and get the information from it.
Yeah. Great. Sounds great. Okay, so I think this brings us towards the end of the webinar. Thank you so much, Dr. Shadi, and thank you so much, our esteemed participants. Please stay tuned for more thought-provoking and engaging webinars and events by the CLI Health program. And have a good evening, everyone.